A very good morning to one and all. This is Dr. Jyotirmay, consultant gynecologist and fertility specialist from Avira Hospital. So today we are going to talk about the importance of torch screening. The torch screening has been playing a major role in recent days. So what is the full form of this torch? T means toxoplasmosis, O means others in other infections like HIV, syphilis, Zika virus, and R stands for rubella, C first stands for cytomegalovirus, and H stands for herpes simplex virus. So why this screening is important is that it is playing a major role not only in infertility but also in the pregnancy. So first let us know how we are going to screen for this torch infections. So in torch infections, what happens is whenever any bacteria or virus enters the human blood, the human is having an immunity. So this immune system will be fighting against this bacteria or viruses, and in the result, as a result, they are going to release the immunoglobulins. These among these immunoglobulins, the major ones are the IgM and IgG antibodies. So these antibodies, we are going to measure these antibodies which are specific against these viruses. So IgM, if it is positive, it means that the patient is having any recent infections or ongoing infections. And if it is IgG positive, it means that the patient had already infected in the past. So based on this, whether the IgM is positive or IgG is positive, the treatment varies. And this infections, how these infections are going to affect the fertility is that the environment in the uterus changes, even in the fallopian tube, the environment changes, and these infections, there are chances of recurrent abortions. And how these infections are affecting the pregnancy is that it depends on whether the woman is infected by these viruses in the first trimester, second trimester, third trimester. The severity varies. So these infections, how they are going to affect the female and the baby is that there are chances of developing the cleft palate, congenital heart diseases, and cataract to the newborn babies, and also having chances of microcephaly, megacephaly, and all. Not only this, there are chances of having even the sensory neural hearing loss and rashes on the skin of the babies. And not only this, when the baby is being affected by these infections, are that how they are going to transmit is that either through the placenta or during the delivery. So depending on which trimester she is being affected, the treatment varies. So all medications will not be given during the pregnancy. So it is better to consult a gynecologist if the patient is having any fever or any rash or generalized weakness. So it is better to consult the gynecologist. Thank you.